Good morning, welcome Cam. We are here today with Cameron Pelzel, who is the Community Paramedics Manager. Now that is a pretty impressive term that carries a lot of responsibility, and Cam has taken it to a whole new level. Cam, tell us a little about what you do, what inspires you, what got you started on this?
So the best way to describe this program is we create the bridge from overdose and withdrawal from opiates into long-term care. So realizing that this was a very big need in the Tampa Bay area, we had patients that were experiencing overdoses off of fentanyl, heroin, medications like oxycodone, and having withdrawal symptoms. They were going to the ER, they were getting medically treated under an emergency status, but there was no one there really to help bridge them from that into getting into recovery.
So then it really makes it easy for them to lapse right back into it.
Absolutely. It's just a never-ending cycle. Someone that is experiencing an overdose, they get the withdrawal symptoms. They were treated in the ER, they got the medications, they're feeling better, but then once all those medications start wearing off, they get discharged from the ER, they start feeling those symptoms again. And the only way to get rid of those symptoms is one of two things: taking the opiate again, or starting medication-assisted treatment. And that's where we come in, is we provide medication-assisted treatment outside of the hospital.
So do you actually go to where they are?
We go to wherever they are, anywhere in Hillsborough County. So from the multi-million-dollar mansions to someone living in a tent behind a gas station, it doesn't matter where you are. As long as we can pinpoint where you are and you can tell us how to get to you and when to get to you, we'll be there.
You will actually go to them wherever they are. I mean, do you sleep?
You're right. The good thing is we have these very nice vehicles that get us around the county. So as long as they can tell us where they are, we're definitely going out there. Addiction does not discriminate. So addiction can affect absolutely anybody out there. Most of the time that the addiction is started by some type of traumatic event. So there's a lot of co-occurring mental health concerns that we're dealing with as part of the crisis center. So we have some amazing partnerships with our local fire rescue, law enforcement, and our hospital partners. So for example, if a patient goes into one of our hospitals, into one of the ERs here in Hillsborough County, they can actually contact us. It can be the physician, the nurse, or the social worker at the hospital. And as soon as they pick up the phone and they call our office, our goal is to ultimately get out to the ER and see them while they're in the ER, explain the program, introduce ourselves. That way they're in that setting, people are already coming to them, and then we can explain the program, and it's a completely voluntary program. If they don't want involved in this, they don't have to, but we're there and we explain the program and tell them wherever you are in Hillsborough County, if you want to start on your recovery journey, we can get you connected to obviously our services, all the other services here at the crisis center, and we will find you a treatment facility for either inpatient or outpatient care.
This is something I don't think I have ever heard of anyone doing before.
So this is the very first in the count.
Okay. And you started it.
Yeah.
Thank you. Thank you so much for that. That is awesome. Now, maybe there are people who have lapsed and who haven't been lucky enough to, have been in one of the hospitals or the treatment centers where they are connected with you. How do they find you? Do they just call the crisis center?
The easiest way to get a hold of our program is contacting 211 or 988. So anytime you call 211 or 988, that comes into the crisis center, and that's when they're going to be screening the call, and they can actually create the direct referral into our program and into recovery navigation program. And recovery navigation is the peers in long-term recovery. So that's the best thing about our program, is we're able to provide that medical standpoint and have our peers in long-term recovery also be that person, be like, I've walked in your shoes before, I know exactly how you feel. So it kind of gives them that twofold of, sometimes these people are just, honestly, they're really afraid of medical personnel, that we're not understanding them. And that's the biggest thing with this program, is that's broken down so many barriers of knowing that, yes, we are clinicians, but we are there actually pretty much holding your hand and walking you through the entire process.
And I think that is one element that can really break that cycle, knowing that there's someone there that understands you, that's not judging you.
Right.
Because, you come from the place of, we're meeting you at your level where you want to be met.
Yeah, we don't want them to come to us. That's where we will come to you. I have trekked into homeless camps. I have parked the vehicle and walked a mile back into a homeless camp just to see somebody. And that was the most comfortable thing for them. They didn't want to come out of the woods. They didn't want to come out and be seen in public. And it's just wherever we can meet you, we will definitely do that.
One last question, Cam. What does the word hope mean to you? Like, our series is called Talk of Hope. So what does hope mean to you?
Hope for me is being that person that can be very understanding and be like, I am here for you no matter what happens in this process. And even if you relapse, we'll get you right back into the program. So hope is a never ending word for me.
All right, Cam, thank you so much once again for all the work you do. You and your crew, you'll make such a difference to all of us here in Tampa Bay. Thank you. Oh, looks like one of your team is on the go.